We are going to pause the chat for the speakers so there's not too much interruption. And but yeah, so I'd just like to really welcome our four speakers, and starting with tonight with Dr. Margaret Beavis, who is formerly a GP, and Margaret now teaches in the medical faculty at Melbourne University and has lectured on nuclear issues to the Masters of Public Health students. She's also Vice President of the Medical Association for the Prevention of War, which is a major peace and anti-militarism organisation in Australia. So we really welcome, Margaret's going to talk to us about the health implications in this, webinar where we're looking at the risks of the nuclear industry in Australia. Welcome, Margie.
Thanks, Maggie. Thanks for that kind introduction. I also would like to acknowledge the Boonwurrung people of the Kulin Nation, their elders that have looked after this land for generations without messing it up, and also acknowledge the considerable and ongoing health impacts of colonisation. Okay, so when it comes to health, the Coalition's nuclear plan has problems on just so many levels. There are so many issues. The nuclear lobby reminds me a lot of big tobacco, where a lot of money was spent to convince people everything was just fine and dandy with their product. I'm going to talk about the real world health impacts on workers and communities, and also the national impacts, which is where Far North Queensland, I think, will be most impacted. We know radiation causes damage to living cells, particularly our DNA, which is our genetic material. It's worse for women, and it's much, much worse for kids. We know there's background radiation in everyday life, and also that cancers that are caused by excess radiation look just like every other cancer. What's useful is that in the last few years, there's been a gold standard study called the InWork study, which looked at over 300,000 radiation workers and measured how much radiation they were getting, and also kept studying them to an average age of 70, so that the delayed health problems had time to show up. This was really useful because it actually showed that there were indeed increased cancers, but also, surprisingly, increased heart attacks and strokes for these workers. It also clearly showed there is no such thing as a safe lower limit. The sales pitch you'll get from the nuclear folks is that radiation is harmless. But if radiation is harmless, why every time you go for an X-ray is there a big sign saying, if you're pregnant, please tell us? And the reason that is because we've known since the 1950s that radiation for unborn babies is pretty terrible. It increases their risk of leukemia and stroke. And in fact, there's been concerns about leukemia and cancer, not stroke. There's been concerns about leukemia in children for decades. And this was first picked up in the 1980s when they noticed around the Sellafield reactor in England. So the UK government thought, we'll fix that. So they did a big inquiry and actually found that, yes, indeed, there was increased leukemia around the Sellafield plant. In 2007, the US government, the Department of Energy, examined all the reliable research globally and also confirmed a significant increase in leukemia for children living near nuclear power plants. If you want to look at the clearest findings on this subject, there's a large national German study which looked at kids within 5 kilometres for the 16 operating nuclear power plants there, and studied this for over 25 years. And that indeed showed that it was more than double the incidence of leukemia for kids living within 5 kilometres of a nuclear power plant. And that if you looked at the risk graph, it didn't go back to a normal level of leukemia until you were more than 50 kilometres away from the nuclear power plant. So I know North Queensland isn't actually getting a nuclear power plant, but still climate change is where the biggest concern would be for North Queensland. The Coalition plan massively prolongs coal and gas usage, and using their own modelling, it almost triples emissions between now and 2050, and that is with their wildly optimistic timelines. If you look at the UK, the US and France, who are comparable countries, although they have a lot of experience in nuclear technology, these timelines are nonsense. The delays in building these reactors is huge. And with delays, the increase in emissions will be much more. Climate change is bad enough already, but this policy will give us worse floods, worse bushfires, worse cyclones, worse heat waves, and worse droughts. And all of these have major health impacts, especially on regional and remote communities. And don't forget that nuclear power plants themselves are vulnerable to these major weather events. The next question is water. Nuclear reactors use much, much more water than renewables. And as our planet continues to heat, water insecurity is increasingly becoming a serious public health problem. If someone's enthusiastic about nuclear, ask them, when future droughts happen, will cooling the reactors be prioritised over the needs of the local people, agriculture and nature? The next concern, and there are so many, is nuclear accidents. Again, to the real world, if nuclear reactors are so safe, why is it always the taxpayer that has to underwrite the commercial insurance? Because no commercial insurer will cover for the risk of a catastrophic accident. And if they are so safe, why does every home insurance policy across Australia say they will not cover for damage from nuclear accidents? Complex technology systems all fail at some point, and nuclear reactors are no exception. The best known accidents we know of are Windscale, Chernobyl, Three Mile Island and Fukushima, but there have been at least 20 involving fuel or reactor core damages, and there have been many, many near misses. It's worth thinking about Fukushima. More than 10 years later, the reactor is still leaking and dangerous, and lots of contaminated water is still being dumped into the Pacific Ocean. The former Prime Minister of Japan, Naoto Kan, said it was just dumb luck, or he didn't use those words, but that there was a real possibility of needing to evacuate Tokyo. And in fact, it was a question of prevailing winds and the fact there wasn't precipitation, that they didn't have to evacuate Tokyo. If you can imagine evacuating 35 million people. It's wind direction that determines where the radiation goes. And Jim Green, who's fortunately speaking later, will tell you all about nuclearplume.au, which maps the fallout zones from Fukushima for the reactors in Australia, looking at the wind directions and who would actually be contaminated in an accident. The Khalid reactor would be less than 1,000 kilometres from Cairns. It's worth remembering that for Chernobyl, North Wales was more than twice that distance away, but the uplands were still contaminated by that disaster. It's also worth remembering that back in 2007, when nuclear was a live option, the modelling by the Australia Institute said that additional sites for nuclear power plants could be Townsville, Mackay, Rockhampton and Bundaberg. Heaven forbid that actually happens. In the last couple of weeks, we've seen the Australian Security Leaders Climate Group, which includes Australian Defence Force Chief Chris Barry, warning that the coalition's nuclear plan could leave Australia vulnerable to devastating attacks. And these days, cyber attacks using AI or sabotage or drones are all possible and not nearly as difficult as previously. It only takes disrupting the power of the cooling water to supply the reactors for a few minutes, and even the supply to the cooling ponds, to cause a meltdown and or an explosion. And this could potentially cause extensive, severe radioactive contamination requiring long-term evacuation. And if you think it can't happen here, just know that between 1983 and 2007, there have been multiple threats against the Lucas Heights research reactor, including one where there are explosives and detonators found within the boundary inside an electrical substation. And lastly, but definitely not least, there's the issue of waste. Nuclear power reactors produce highly toxic radioactive waste that needs to be kept safe from the environment for more than 100,000 years. This is a significant health burden, and we're passing it on to our kids and to our children's children and so on, many generations. Remember, the pharaohs in Egypt were only 5,000 years ago. In the real world, there are no high-level waste disposal anywhere. Finland plans to open one next year, but it's taken over 40 years and it hasn't happened yet. Nobody wants this waste, especially not our First Nations people who have been so often targeted. And as Margie noted, they've been looking for a place for our waste, our small amount of waste, which is only intermediate level waste, from the Lucas Heights reactor for over 40 years without success. So, in closing, the next time someone tells you that radiation is harmless, remember the signs in the X-ray clinics. Remember the childhood leukemia. Remember, we now have really clear evidence that there's increased cancers, heart attacks and strokes amongst workers. Remember, there is no such thing as a safe lower limit. Remember that governments and taxpayers and us are the ones that have to cover the insurance, that no insurance company will cover a catastrophic accident and no insurance company will cover your home. Remember to ask, who will get the water in the next drought? And never forget the highly toxic waste, which usually ends up staying at the reactor site for decades, and this increases the risk of accidents. So, in closing, nationally, the biggest issue for all of us in North Queensland, down here in Melbourne, is the climate impacts. Across Australia, this plan would have worse cyclones, worse droughts, worse floods, worse bushfires, worse heat waves. And from a health perspective, this is totally unacceptable. It's a recipe for more disasters and more deaths. The good news is that renewables are here now. They're much safer, they're much cheaper, and they actually do help with addressing climate change. Thanks for listening.
Thanks, Margaret. That's very, very in a nutshell. Thank you very much. So we thought we'd have about, we're sort of doing it on a 10-10 sort of basis, but we don't have to use all that time because then we could finish earlier. And we do have 4 very excellent speakers. Karina, I think, hasn't joined us yet, so we might be changing the order up a little bit. But in the meantime, it would be good to hear a couple of reflections or questions. And we're particularly interested in, you know, the application to Far North Queensland. And there's a lot of people who live in Far North Queensland or have lived a long time in Far North Queensland. So it's good to hear those reflections as well. So just short reflections or a couple of questions, and then we'll put that back to Margaret to respond to close around that. Yep. So yeah, you can put your hand using up, there's a react button, and in the react button, well, you can just put anything in the react button, and if you put anything in the react button, I'll assume that means you want to speak. Yeah, Mr. Holland.
Hi, Margie and everyone. I'm just wondering if Margaret or anybody could recap how many nuclear reactors the LNP plan to build and what percentage of the total electricity demands will this fulfill? Because I understand that even, I'm not sure how many, was it 7 reactors? But that would still be a very small proportion of electricity demand.
Jim would probably be better. I've understood it was around 5%, but I also think their modelling, their very problematic modelling, is for a much lower total energy supply. It's about half what the total energy supply is. And I think on both those counts, there are problems. In terms of number of reactors per site, I'm not sure. Jim might be more aware of that detail.
Where maybe when Jim speaks, he can respond to that later, Jeff, if that's all right. I'm sure he'll include that.
Or I could answer it right now if you prefer.
Yeah, I'd jump
Maybe.
in. Yep.
Yeah, well, how much power would these nuclear reactors generate? It really is a very difficult one to answer. If we look at the projected total electricity generating capacity in 2050, and if we assumed that the coalition builds the reactors it says it wants to build, then, you know, we're talking, say, 5% of overall capacity. And in terms of generation, well, maybe 10 to 15%, something of that order. You know, the coalition claims it will be higher, but they're assuming nuclear operating with a capacity factor of 90%. Well, it's not going to happen in a grid dominated by renewables. So anyway, it's just not an easy one to answer. And in terms of how many reactors they would build at these sites, well, they say multiple reactors at each site, but they haven't been any more specific than that. So we'll just have to wait and see. But that gets us back to one of the safety issues, where when you have multiple reactors at a site, then you can have multiple disasters at one site, either because of some common cause of a nuclear disaster, such as the loss of off-site electricity supply, or, you know, damage to one reactor damaging the adjacent reactors. And we certainly saw that at Fukushima as well. I'll leave it there, Maggie.
Thank you. Yeah, so back to Margaret's. So Margaret talked about the health, and the idea of the insurance, the health. You know, insurance is something we already understand quite a lot about in Far North Queensland, as you know. So yeah, is there any other reflections on the meaning of those, the health? I mean, the thing that would occur to me about Far North Queensland is that we're also already quite a small and stretched community in terms of having a local base hospital. That's a hospital that already services a massive region, along with the Townsville base hospital. And yet we have quite a small number of people and quite therefore a small number of staff. So our ability to, respond to, I guess this is an issue for Townsville and Collide or whatever, would be those sorts of issues, our remoteness, I guess. Have you got any thoughts about that, Margaret?
I think for the people much closer to the reactor, the issues then come down to what are you going to do instead of if there is an accident? And what's interesting is that in France, around one of their reactor regions, they recently really increased the number of people being issued with with stable iodine by about 2.2 million, because they recognise that the wind direction is very important where the fallout goes. And with radioactive iodine, if you're going to have any effect, you really need to take it either before the accident, because you can tell an accident's coming, or within 2 hours. And ideally, after 8 hours, it's lost a lot of impact. And after 24 hours, taking radioactive iodine will do more harm than good, because it will increase the length of time that the radioactive iodine that's got into you from the fallout is in your thyroid. So that's only just addressing the risk of thyroid cancer. But it's fascinating when they say this is such a safe industry. Why did the French government suddenly decide to issue 2.2 million people with stable iodine? And whether the people in Townsville are going to be issued with stable iodine is a whole question for the people in Townsville. I mean, it's really interesting to look at the nuclear plume data that Jim put out yesterday on the anniversary of Fukushima, because really there should be some very sobering thoughts about who is going to have radioactive iodine, because you can't just say, oh, we'll issue it when there's an accident, because if it's going to have to be issued so quickly, people actually have to have it in their house, has to be within date, like medicines. I mean, it's a whole can of worms, the sort of safety issues around a nuclear reactor.
Well, if there's no other comments, maybe we'll move on to thank you very much, Margaret. So just there's one moment for somebody else to make another comment about the health issues of that are associated.
I just say, just think about big tobacco. There's a lot of money being spent at the moment to whitewash this industry.
Yeah.
Over the web. I wouldn't mind saying something on that. You know, the question is for regional areas, if we can't get iodine very quickly, you know, within a couple of hours, do we actually need to be, you know, we might go away from our homes for hours. How do we actually, do we have to carry it in the car?
Yep.
We have to carry it in our picnic bag, you know, just in case. And we can never say never.
Effectively.
Okay, so I don't know anything about that. That's just a completely new area of the iodine question, which I don't know. Never heard anything about
and
it.
That's only protecting you from your thyroid. Doesn't stop any of the other cancers or the leukemias or the other stuff. You know, that's just looking after your thyroid.